everybody knows that their machine is over there, that if you open it, the alarm will sound.
Do you want to hear that? We'll do it. Yeah,
Sure, if you want to.
Let's give it a quick go, just so you know, but don't panic, it's about to go off. As soon as you close it, it stops.
Yeah.
And that's really just in case somebody
Needs it.
comes in and takes it, or, when the door's open and we've got the group in and out all the time.
Then you know what that's
Then you
happening
know.
for. Yeah, and then you can go help if it's taken out of there for a reason, right? So,
The demo model that I brought out requires this strip because it needs something to contact. So obviously we wouldn't need to do this on a real, it wouldn't come with a strip like this on a real patient.
okay.
So then basically with these machines, the three big principles is to turn them on, listen to them, and don't touch the patient when you're shocking them. Okay? So when the patient gets an electrical shock, that's what these machines deliver. The amount of power that comes out of them is measured in joules. So the first shock delivers 200 joules, and then it will increase in joules every consecutive shock for up to 360 joules. And then each consecutive shock after that will stay at 360.
So it does that automatically?
It does, yes. And 360 joules is equivalent to about 750 volts. So it's really important that no one's touching the patient. And the other thing too is that when the machine is analyzing, it's really important that you stay still because excessive movements around these machines can throw them off as well. Other than that, they are foolproof in that they won't shock a beating heart. What it does is once it's attached to the patient's chest, it'll say analyzing, and then if it picks up a shockable rhythm, it will advise you shock advised. And then to put your finger on the shock button, which is here. So this is the on button, this is the shock button. And we really encourage people to put their finger on the shock button and look around. And then when the machine says deliver the shock, you push the button right away, but still looking around to make sure that no one's touching the patient.
Do you suggest that somebody be designated, or whoever's about to do this, designate someone to keep people back then?
Yes, good idea. Yeah, good idea to get people even out of the room if possible. The less people in there, the better.
Yeah, sure.
It's hard, especially if the family member is in there, to ask the family member to leave, but that's why we do it as paramedics. I'm also a licensed paramedic. We have family members leave because we are doing things to their loved ones that they may not understand. And CPR can bruise and break ribs, and it can make very nasty sound. And we don't want the loved ones around for that kind of thing. So then the best place to put this machine is right beside the patient's head. So that no matter who pushes the button, it's whoever's closest. And then that way we avoid reaching over the patient to push the button. So you turn it on.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
Everything has to be off.
When patient's chest is bare, remove protective cover and take out white adhesive pads.
So that's those ones, and they have drawings on them to show you where to place them. So it doesn't matter which one you do first.
Look carefully at the pictures on the white adhesive pads. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
So you place this one here, and it goes side to side. And
When
then
the
this one
first pad
here
is in place,
above the
look carefully at the picture on the
breast or
second
neck
pad.
muscle.
Peel the second. No one should touch the
So
patient.
then you make a barrier, make sure
Analyzing.
nobody's touching.
No one should touch the patient. Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered. Be sure emergency medical services are involved.
So that's your
It is
manual
safe
one.
to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat. nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
So this machine is timing me for 2 minutes of CPR. It will
Pinch
be the
nose,
longest 2
tilt
minutes of
head,
your life.
and give 2 full breaths. Breathe. Breathe. Continue with compressions.
Can that thing detect whether a person's heart starts beating during this process?
Automatically,
Okay.
instantly.
Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
This should be the last set.
That's very easy to follow
Yeah.
Yes.
instruction,
Great.
isn't it?
Yes.
That's very good.
You take all the guesswork out.
And then having that rhythm to
Stop CPR. No one should touch the
So
patient.
now it's me analyzing.
Analyzing. No one should touch the patient.
Everyone's clear.
Shock not advised.
Okay.
It is safe to touch the patient. If needed, begin CPR. For help with CPR, press the flashing blue button.
So when you don't get a second shock, and it's telling you to begin CPR, if needed, it is needed. So what's happened is the heart, to no fault of anyone, has gone into a non-shockable rhythm. So then the hope is in 2 minutes, it'll reanalyze, and then hopefully we'll get another shock or the patient's heart has stopped or continued to beat again. So if the machine picks up another heartbeat, it'll say no shock advised, check for signs of life. So then you would go back to A and listen for breathing and do that kind of stuff. So literally that is how easy these machines are to use.
Will it stop if we start breathing right away?
They will. If the patient becomes back to life, the machine will say, no, stop CPR and check for signs of life. It does all the work for you.
The pension of pinching the nose, you may have mentioned it before I got here. You don't need it with this?
No, because we're not doing mouth-to-mouth anymore. That's what I have the pocket mask for.
If somebody was outside and it was raining, would that present a complication for this equipment?
No, you might get a residual shock from the moisture, but it's not going to cause any damage. They just can't be used in standing water.
Mm-hmm.
So if you choose to do mouth-to-mouth, if it was a loved one, I certainly wouldn't use a pocket mask on my daughter or my husband. Some of my family members, I might still use one.
Yeah.
We really aren't encouraging mouth-to-mouth anymore. So if you do mouth-to-mouth, your mouth goes over their mouth, and then you plug their nose. Okay?
But one of these is in the kit.
One of these, I think you have one of these with your machine. It should come with your machine. Do you have a pocket mask over there?
Yeah.
Yes, I was going to just show this to Anne.
Yeah, the pocket mask is a personal protective equipment. So what this allows is air exchange with this one-way valve, but it doesn't allow fluid exchange. So it really does protect you. Cardiac arrest patients are very prone to vomiting. So if they do vomit, this will protect you from getting that in your mouth. Okay. They can be cleaned and used again. So how we clean these is 10 part water, 1 part bleach, and we take it apart and soak it for 10 minutes and then air dry it.
Okay, and that instruction is probably in here.
I don't know if the cleaning instructions are in there, but
So this is it, and it's in with the other.
the AED.
It's the AED,
Yeah.
yeah. So that's it, just needs to be taken.
Yeah, and you can also get
It does have.
face shields. Does it have the the instructions in it?
Cleaning pads.
No, it's got a.
Sterile.
Oh, that's to wipe down the sweaty chest.
Yeah, that's the.
Patients that are in cardiac arrest are very prone to having, are in shock. So if the pads won't stick to a sweaty chest, that's
Right.
what that's for.
Okay, and there's the scissors then.
That's to cut the clothing.
Yeah.
And then the razor in here is to shave the chest if the patient's got a lot of hair on their chest. You're not manscaping, you're just shaving where the pads are going to be placed. So just shave here and shave here. So as you saw, the pads do have drawings on them. So if you put the pads on the wrong spot, it'll tell you poor pad placement.
Oh, it'll tell you that?
Yeah.
Okay.
Well,
If the patient has an implanted defibrillator, which will be obvious to you when you expose their chest, the pads need to be 1 inch away from that site. Okay. So the old implanted defibrillators, there'll be a scar down the center of the chest. The new implanted defibrillators, the scars over the left side.
Right there.
Well, and it will be obvious, right?
we arranged him to be here just so we have him.
So the pads need to be 1 inch away from that site. So several inches below the patient's left armpit and above the muscle. You want to make sure that you clear the nipple because electricity works in such a way it'll contact the closest spot and that will damage that person's nipple. So make sure that you're clear of that. And then the face shield is something else that you could look at getting. This is a one-time use version of that pocket mask.
Okay.
So it comes in a kit like this for $6 and it has a one-way valve in here. So this valve sits inside the patient's mouth. This plastic covering goes around the patient's mouth itself. And then it also comes with gloves, roller gauze, bandages, and some antiseptic wipes. And they're a one-time use, so once this is open, it's garbage.
What about if somebody has a pacemaker?
Same idea as an implanted defibrillator, so 1 inch away. You're going to be 1 inch away anyway. If the patient has any medication patches, you'll need, where the pads are going to be placed, you'll need to remove those medication patches. Right?
There's a lot to do before you get started.
Well, they have to have a clear chest,
Yeah.
right? Just simply because if the pads are not, if the patient doesn't have a flat chest, the pads won't stick, right? So, but that's really the only patients you have to worry about. The sweaty chest, wipe it dry, the hairy chest, shave where the pads are going to be placed, watch out for those implanted defibrillators, and also watch out for medication patches. That's it. Everybody else you can use. You can use them in a wet environment, okay? Not in standing water, so no puddles, no pools. When you do CPR, the patient needs to be on a firm, flat surface, so the ground, not tables, not chairs, not couches, not beds, and at least 2 inches deep. Right?
You will break ribs because one, no, he's cracking anyway.
Yeah, and you can damage cartilage as well, but you're
You're still up.
But
Yeah.
still here, but on my
That's
mental
right.
faculty
and
still.
they healed, right?
Right.
In the case of a woman, best to remove the bra and so forth.
Yeah, remove everything. Yeah. Yeah. If the patient has piercings where the pad's going to be placed, unfortunately those get ripped out.
Oh,
Yeah, so that's why I really, when I go talk to the students, the high school students, I say don't pierce anywhere here or here, right? The dermal piercings are really popular right now for some reason. I say those just get ripped out, so don't pierce up there. Yeah.
So how can you tell if someone has a pacemaker?
There'll be a scar down the center of the
Yeah.
chest.
Oh, there will
I can
definitely be a
show
scar.
you.
Okay.
Yeah, it'll be very
It's
obvious.
very obvious.
Okay.
And it sticks out.
It
Mine
does.
Yeah, much
too.
like Larry.
And you can see
You can see
it
the
as well.
outline of
You can see
it.
the
Right.
outline.
You
You
can
see
see
the
where
outline.
it is.
Not very
Okay.
deep.
Yeah, absolutely. Yeah, it'll be very obvious to you. Now, with the machines, Work Safety C governs these as well in the workplaces. So they're really encouraging people to have a medical director. So that person will be in charge of making sure the machine is where it's supposed to be, maintaining the equipment that comes with the machine. So make sure there's a razor in there, make sure there's a pad. And then there's checks on each model of machine. So what you can do is go onto the website, HeartStart, and ask the question, what are the weekly checks, what are the monthly checks? There's 2 types of batteries in these machines. So the one battery is just regular 9-volt, that's for the voice activated part of these machines. And then the other battery is the special battery pack that comes with these machines. And those are good for about 3 to 5 years. Because the last thing you want to discover when you have to use the machine is that the battery is empty.
Yeah.
So,
And I think I've got things date stamped and everything in
Yeah.
there too.
absolutely. They're very user friendly, these machines. and they have saved a lot of lives. They're increasing. There you go. They're increasing people's chances of survival by 50%.
How much time do you have to get this going by the time from when you realize that somebody's heart is stopped?
Well, do CPR until the machine shows up. Once the machine arrives, CPR stops and the machine gets put on. So the brain and vital organs can go 4 to 6 minutes without any oxygen. But if you are doing CPR, you are supplying the patient with oxygen. If you're not comfortable doing mouth-to-mouth, at least do compressions, because when you compress, you push blood through the body and oxygen gets picked up by that blood. So you are supplying the patient with some oxygen. It is considered a hazard to do mouth-to-mouth.
Some of the stuff on TV or on the internet
Right.
don't talk about the breaths at all. They just
No.
say
Because most people don't carry this stuff around
Yeah.
with them, right? So I'm kind of a big first aid nurse, so I carry this stuff all the time. So they have 4 to 6 minutes without any oxygen, but it all depends on what kind of heart rhythm they're in as well. So that when people go into cardiac arrest, there's 2 heart rhythms can be shocked by the machine, and 2 of them can't be. So the machine does all the work in reading those abnormal heart rhythms. So the most common abnormal heart rhythm that people go into is ventricular fibrillation. So picture the heart as a bowl of jello. So it's quivering, but it's not producing an effective flow. So if the machine picks that up, it's going to say shock advised. The non-shockable rhythms are that flat line that you see on TV, right? You can't actually shock that, right? It bursts that Hollywood bubble. There's no electrical activity pumped through the heart. So if the machine picks that up, it's going to say no shock advised, but it will encourage you to do CPR. Because by doing good CPR, you push the heart into either a shockable rhythm or get the SA node to reset.
Well, that blue button there,
Yes.
it'll come on and say,
If you need help with CPR, push this blue button.
yes, you might as well.
Absolutely.
Yeah,
Absolutely.
it gives you that rhythm.
Yeah, and it
That's
kind of
fine.
helps you out, right? It takes you through all the
It's going to
steps.
tell you what to do.
Yes, because quite frankly, anybody that tells you they don't get nervous for helping somebody in cardiac arrest is lying.
Oh, yeah.
Right? I still get nervous
Yes.
when I do CPR, and I've been doing this for a long time. So nerves are part of this process. So that's the nice thing about this model. It is that not every model has that button. Right? Not every model has that counter.
Is this the same one?
Yeah. It is the same model, of course.
Yes.
Just different color.
Yeah, so that's the.
This is not related. Can you tell me how much? Because we have another group that are interested in one. Can you tell me what?
I believe.
Well, I'd have to check. I just want to mention as well that we also have children's paddles. So we have adult and children's paddles. Both, so.
Okay,
Around $1,700.
Okay, that's all I need.
yeah.
Remember the stereoscopic ones get busted, but.
Yeah. Well, you can get really fancy. I mean, they can run as high as $2,500. Right? But that prints out the ECGs. You don't need. I don't even know what those things mean. So I have an idea, but
And it depends if you want to get a case.
Yeah.
Right.
Or into the wall mount as well.
Yeah.
Like a truck package costs $1,700.
And a bit more than that, yeah.
It's still worth having.
Oh,
absolutely.
Yes, absolutely.
I presume that the city and people like that like to know where the location is, so that the fact we've got one, that's good that they know, so if something happens out on the street, you know there's one close by.
Absolutely. And I mean, phoning 911 is vital as well. Firefighters have them on their trucks. EC Ambulance has them. Fundamentally, these machines all work the same. So what will happen when the paramedics pick your patients up is they'll unhook these leads from your machine and hook up their machine. The pads are all universal. So then they'll give you new pads.
I got a kick out of the one at the ball fields in the Mission. It's inside the men's bathroom.
Oh, lovely.
No, it's just around the corner. I mean, it's just inside the door.
Absolutely.
It's a safe place.
It has to be in a safe
And it needs to be a
place,
low area.
Yes.
you know, not-
Easily accessible to everybody. Yeah. And they are becoming more common, right? We're seeing them at ball fields, we're seeing them at the airport here. St. John Ambulance has one.
Kelowna, every building, Kelowna building has got one.
Absolutely, yeah. And they're saving people's
City
lives. There was one in West Bank in the last 18 months that has brought 2 gentlemen back and they're still alive. Hockey arena.
That's where I have.
Yeah, well, there was one where a gentleman went into cardiac arrest on the ice and the machine had run out of batteries.
Yeah, that's probably me,
That was insane, yeah.
because they tried to run the machine and the rink, it didn't work. They
Right.
couldn't hear the instructions particularly well.
Right, and that's the other thing too, is that depending on the model, depending on where you have it, There are some models that have visual capabilities, so if it's a loud environment, right?
Yeah.
So how often should you check that battery? Every 6 months?
I would suggest every 6 months, check the main battery. Right?
Yeah.
I believe it's all written in what checks are when.
The biggest thing for us, I think, or at least what happened in the situation, is to make sure somebody's designated to keep on top, but also to keep on top of the maintenance of the machine.
Yes.
So somebody takes that responsibility on to say, okay, and they have a checklist to say, okay, it's been checked.
Yeah.
Because that's typically what happens, is you forget about it.
Well, exactly. Make someone a medical director.
And we should log it too,
Yeah.
because we do regular monthly fire alarm checks and that type of thing.
Yeah.
So we really
Document
have to do that.
everything.
You've got it.
Oh, thank you.
So I could add that to our fire log
Absolutely.
as well.
And you've got the main fire hall nearby, and BC ambulance station
Yeah,
is.
not far away.
They're not far away. You know, people move out of the way for them.
Adult training pads.
And the pediatric pads.
Begin by removing.
The pediatric pads that you mentioned that came with these machines, they are placed differently than adults.
Right.
And once again, they would have drawings on them. So in first aid, anybody over the age of 8 is considered an adult. So the pads for the pediatric pads goes in the center of the chest, and then the other pad goes in the center of the back. Just because of the size difference between children and adults, you don't want the pads touching each other. If you don't have the pediatric pads handy, then put the right pad in the center of the child's chest and put the left pad in the center of the child's back. Okay? And then the machine will actually deliver less of a shock that way as well, because children don't need 200 joules of power. And chances are the child's not in cardiac arrest anyway, but because we don't check pulses anymore, it's respiratory and cardiac arrest are considered to be the same now. There's no more carotid pulse checks.
It's a waste of time, is it?
Well, and it
takes
is,
time.
and it isn't. I mean, you're not going to damage the beating heart if you do CPR to someone who has a beating heart. The other reason is that people were delaying CPR because they weren't sure if there was a pulse there. Carotid pulse can be very difficult to find, especially if your patient is larger or if there's lots of movement or vibrations around. And delayed CPR is never bad. So you're not going to damage the beating heart by doing chest compressions on it. So basically, if a person's unconscious and not breathing, or not breathing normally and unconscious, then we assume respiratory and cardiac arrest. So cardiac arrest patients very commonly will develop something called agonal breathing. So agonal breathing is not to be mistaken for normal breathing. So when you do that head tilt chin lift to remove the tongue off the back of the airway, and you hear gasping noises coming from their mouth, that's not normal breathing. And what you won't see is that chest rising and falling. Right? Their air is escaping their body. It's a reflex. So when you do that head tilt chin lift on the adult, you want to listen for at least 5 to 10 seconds. And then with agonal breathing, what you won't hear is normal airway sounds coming out of their mouth, and you won't see that chest rising and falling. So that person is considered to be in cardiac arrest. So then start CPR with compressions. So the minute you discover that, or you don't hear any air movement coming out of their mouth, get on that chest and start doing chest compressions.
If you're by yourself, is it best to start CPR or to get the machine going?
The machine. Get 911 on the way, get the machine with the adult. With the child, if you're by yourself with a child, do 2 minutes of CPR first, because it's most likely respiratory in nature, not cardiac, so the faster you start CPR on the child, the better the chance they have of coming back. But with the adult, they most likely need the machine.
Okay.
Yes.
Now, we have a number of groups that use the facility. What do you suggest we do for training with them on that? I wanted to get us trained first, and then look at that. A lot stop for the summer,
Right.
and then start again in the fall. But
I mean, we could do it one of 2 ways. You can have me come back up, or they could come to St. John, and I can show them there. I mean, I have no problem popping up. It's not that far from St. John.
right. Well, see, so they meet at different times.
Right.
So there's
exactly.
the guides. Right
Right.
now we have Opera Kelowna doing rehearsals here.
Mhm.
We have federal retired workers that,
Right.
that meet here. You know, we have various.
There's one to probably get.
So, and private. Yeah, well, we
Yeah.
have, but you know, and
But
some
somebody
of them
can
they
come out
have different things.
Might
you
have
know.
different trainings.
So yeah,
Yeah.
but so it might be better to ask them to designate people and send them to you. Would that be okay to
That would
do?
work. Yeah.
Right.
Yeah, you just have one designated person, or I come up here and show them this machine.
If I could get them together at the same time, that
Yeah.
would be handy. That's the hard part, even with us.
Right. Yeah, just getting organized to, meet people's schedules and things like that. And the other thing too is that it's good to have a CPR AED ticket, right? Because that's just basic. It's a 4-hour, not even 3 hours of training, which we offer at St. John, or I can come up here. I mean, we're fairly flexible at St. John.
Yes, and I've actually been advertising for that too, so.
Minimum
State
6
Fire
students, yeah, up to 18.
Yeah, that's right, 18, yeah. And I think I've got 4 now.
Okay.
So anybody who is interested, a time and date hasn't been set yet. We would probably go to you.
It's easier.
Just because it's easier and will be a little cheaper too, I
Yes,
think, than doing it the other way. So, but
Did you
we'll,
put-
so I can do, yes, certainly. So anybody who is interested, so whether it's to refresh if it's expired or to get one in the first place, and then we can pick time and a day and then book it.
Yeah, it's certainly not, I mean, you could even jump in on a standard first aid class, which is
Sure.
a 2-day class, and then just stay for the AED ticket. And there's no exam, there's just this participation.
If my certificate is 60 years old, has it expired?
It's a couple of years ago, yeah.
Only the ticket.
Yeah. Yeah, a couple things have changed since then.
Oh, I expect so.
Yeah.
Yeah.
I mean, they are finding better ways to do things, right? And it's a lot more
Yes.
objective driven, so there's really no right or wrong anymore. And they really relax the rules around who can do CPR. So you don't actually need specific training. So if you had one person who was trained and you wanted to help and you can have a current ticket, as long as you were understanding what's happening, there's no wrong way to
So
do
that's a good
CPR.
scenario, rule.
Good
Works
scenario
anyway.
will cover you, yeah. Because you're trying to do something. So you can, as a first aid ticket holder, train someone in the field in that moment to do compressions, right? Because it's better than not doing anything. And CPR is exhausting. It's exhausting. It's hard on the body, it's hard on the mind and the heart, and if you can switch every 2 minutes, that's better. Because 2 minutes after 2 minutes, CPR compressions become less effective. And they remember that the heart's in the middle of the body, so it doesn't matter which side of the patient that you're on. So if I was here doing compressions and my partner was over there putting the vents in, and we do 30 and 2, after 2 minutes, so that's 5 cycles, they would end with the ventilations, slide down there, become the compressor, and then I slide up here and become the ventilator. 2 rescue or multiple rescue CPR is so much more effective. Less delay, less tiring, better patient care.
Okay,
So,
yes, that makes sense.
yeah. And like I said, CPR is not a complicated thing. Keep in mind that Annie doesn't feel the same as a human. Well, she feels fairly similar, but she doesn't sound the same. No. And no one told me about that. When I first did CPR for the very first time, surrounded by paramedics and firefighters, nobody told me what it sounded like. And it was scary. But the person came back, so yeah.
Makes it less scary then.
Oh, absolutely. Yeah. It was worth it.
Yeah.
And we didn't get in trouble.
There you go.
So,
Yeah.
Okay.
Yeah.
any other questions, concerns?
Thank you.
Oh, you're very welcome.
Thank you.
All right, put that.
Do you mind if I post this video on the internet?